Hi, I'm Dr. V. I'm Chief of the Spine Pain Program at Bloor Pain Specialists, and today we're going to be talking about radiofrequency ablations of the superior cluneal nerve.
How can you treat pain from the superior cluneal nerve if nothing else has worked?
Radiofrequency ablation is a technique for using a needle with a conductive tip, meaning the tip of the needle can get hot. It's got a wire on the back end, and that heat is applied after freezing a tissue, freezing a nerve. So the patient feels comfortable, but the heat's still there, going upwards of 90 degrees sometimes. And that's used to heat up the nerve to break it down. Now we do that for sensory branches, not movement branches. So people can still move just fine, but it's for removing sensation from any sensory branch, from any painful part. We use it for arthritis, we use it for ribs. Sometimes people have surgery, broken ribs. Sometimes people have painful muscles. So we can go branch by branch by branch for that segment of painful muscle. And the cluneal nerve, just like any other sensory nerves, sends painful signals. So we can heat up the cluneal nerve to cause it to break down, to remove the ability of that nerve from sending a pain signal and relieving the patient's pain.
The procedure itself is actually fairly quick. It only takes a few minutes to do it once we're all set up. And patients who have back pain that's not responding to other methods can certainly benefit from this procedure.
Why would we do it? One, it's accessible and we can see it very easily. Not the nerve itself, but the anatomic landmark for it. It's easily seen on an x-ray, so it's easy to get to. It's quite safe because it's a bit of a distance from our spinal cord and our spinal nerves. And the ablation, basically what it'll do is, one, yes, cauterize or burn it, but what we found is that in doing so, it can calm the nerve down. So when it calms down, it sends less pain signals to the brain. And we're hoping for better pain control.
Who can benefit from having radiofrequency ablation on the superior cluneal nerve?
Everyone could benefit. I mean, maybe that's oversimplifying it, but realistically, the cluneal nerve is probably symptomatic in about 50% of low back pain cases. It's not going to be there for everyone, but it is so common, and it's such an easy thing to find on a physical exam. You can talk to your chiropractor, your osteopath, your physiotherapist, or you could come to see any one of our specialists and we could diagnose it for you. But the cluneal nerve is so commonly symptomatic that just about everyone with low back pain or low back pain radiating through the glutes into the thigh should really think about it as a potential target for relieving their symptoms.
How long can I expect the effects of radiofrequency ablation on the superior cluneal nerve to last?
So there's a lot of variability in how people respond. After an ablation, I would expect the patient to experience many months of relief, although it's quite variable. I know some patients that are getting 6 months to a year and others less so, but the procedure can certainly be repeated if they're getting a good effect.
We just published the largest study on radiofrequency ablation in Pain and Therapy, one of the medical journals, on the effects of superior cluneal nerve ablation, describing at least 3 months of excellent pain relief. Typically 92 to 95% on average in terms of pain relief. Now, some people had longer pain relief, and obviously some people had shorter, but the averages show at least 3 months for 92 to 95% relief.
And several months of relief would be great for a patient, I feel. Thank you for watching today's video. Please don't forget to like, comment, and subscribe. For questions about your care, please contact our clinic directly.